Welcome to Fertility and Wellness Podcast, the show where we tackle the big questions about health, fertility, and everything in between. I'm Mariana, your host, and today we're diving into a topic that hits close to home for so many women trying to conceive. What happens when the doctor tells you to lose weight before starting fertility treatments, but doesn't tell you how? You are left wondering, where do I even begin? Is it really possible to overcome PCOS, shed pounds, and finally get pregnant? In this episode, we'll uncover the secrets your doctor didn't share about weight loss, insulin resistance, and fertility. You'll hear from Dr. Marilyn Galindo, an expert who has helped countless women navigate this frustrating journey. Together, we'll explore actionable strategies that actually work and debunk the myths holding you back. So, if you ever felt stuck or overwhelmed by vague advice, this episode is for you. Stick around. We're answering the questions you've been Googling at 2 a.m.
Welcome to Fertility and Wholeness Podcast. Are you tired of seeing that test be negative month after month? Will you ever stop having to take test after test? Are you scared of all the medical terminology, office visits, and misinformation you see at every turn on your infertility journey? If you answer yes to any of those, you're not alone. You are at the right place. I am so happy you're here with us. My name is Ariana. I'm a fertility care practitioner and a wholeness coach with over a decade of experience on the field. I created this podcast because I know what it is to feel alone and lost while navigating fertility problems. And after helping hundreds of women, teaching them how to not protract their cycles, boost their fertility, and navigate their monthly emotional roller coaster and get pregnant naturally, I am on a mission to empower women to take charge of their fertility journey. In this podcast, you will find heartfelt conversations, education, tips on how to take care of and understand your fertility, emotional support, simple lifestyle changes to boost your fertility, nutrition, self-care routines, tips for handling stress and anxiety with ease. We have amazing, exciting expert interviews and guests, inspirational stories, and practical advice on preparing for pregnancy and joyful delivery. Are you ready to reclaim your health, your life, and become pregnant naturally? If so, grab your green juice and prenatal vitamins. This episode is just what the doctor ordered. Welcome to Fertility and Wholeness with Ariana. Today we have Dr. Marilyn Galindo. She's a board certified in internal and obesity medicine, and she founded the Leon Springs Obesity Medicine to provide compassionate and personalized care for individuals who are seeking to achieve a healthier weight. She's dedicated to empowering patients and helping them overcome their challenges with obesity. Welcome. Can you tell us something about what inspired your work?
Yes, so I am a board certified physician. I worked throughout the whole pandemic, and during the pandemic, I decided that I wanted to do something a little different than hospital work. I used to be a hospitalist. I still am a hospitalist, and I still work in the hospital, but on my time off, I run my clinic where I see patients for obesity care, and so I try to help them lose weight. That way we can prevent a lot of the problems that you can get later on. So it's more of a preventative approach. Like where, yes, you might be a little overweight and you don't have a lot of problems right now, but we don't want you to get problems in the future like diabetes, high blood pressure. Infertility is another problem that I see a lot in my clinic. And so that's why that's kind of my passion right now, is just advocating for patients with weight issues. And yeah, it's really rewarding work, actually.
I imagine. So one of the things regarding fertility challenges is women go to the fertility doctors or OBGYN and they're like, I'm struggling to get pregnant or I'm not getting pregnant and I don't know what it is. And the one thing that they hear is either go home and try a little longer. And they're like, I'm running out of time. This is it's not their ideal. And the second is lose some weight and lose this many pounds and come back. And they're already doing a lot on their end. They're like already thinking like what they're eating, how many days they're exercising, and they're not seeing the weight come up. So what is and they're like, where do I go? Do I go to a nutritionist? What are my options? And they're just telling me to lose weight. But at the end, I feel like I'm doing it all and it's not doing it?
Okay, so I have a lot to say about this. So I think we have to change how we see obesity. I think for a long time, we see obesity as like it's all your fault, right? Like you're not doing enough. And as you know, because you just said, like, you are working with women who are putting in the work, they're doing the diets, they're doing the exercise, they're doing everything. The problem is not everybody starts at the same level. Like some people always struggle with weight, some people never have to struggle with weight. So there is a biological component that goes above just choice. So we recently discovered some new medications that we're using for weight loss, and they're very effective. And people have realized, like, oh, maybe it wasn't just that you weren't trying hard enough. Obesity really is a disease, and it's a very complicated disease. So I can tell you from the work that I do, that a lot of the patients that I take care of, like, they've done it all. Like, I don't have to teach them how to eat. I don't have to teach them how to exercise. But what they're missing is sometimes some patients do benefit from medication. And so we do have medication. So when they come to me, first of all, we do a full evaluation, of their health, because sometimes people might have pre-diabetes. They might have diabetes already, and that makes it harder for you to lose weight. Or in terms of infertility, something that I see very often is PCOS. So women have PCOS, which means they have a hormonal imbalance already. And with that hormonal imbalance, they don't ovulate every month. And so then, and they're insulin resistant. So that means they're prone to weight gain, and it's just going to be harder for them. So when I get a patient that's looking to lose weight for fertility purposes, usually we do a workup, right? You want to make sure you get some lab work, you see kind of where they are, and then you decide what's the best medication for them. And a lot of the patients seriously just starting the medication and some guidance with their food, and because it's a tool, right? It's not like the medication by itself is not going to do all the work. If you have to still do the work with it, but then once we start medication, people start to see results, and it's very rewarding to see that, because they thought for a long time that this was their fault, and it's not.
Yeah. And I guess like when I see women that they get that like one size fits all approach, they feel very discouraged. They're like, what's next for me? Nobody's guiding me to the next step. So I'm so glad that you're speaking on it, because they are doing the work. And I do meet women that they're doing the work. They're like, I cry. I left the OBGYN office crying because I am doing the work, and somehow I'm not believed to do it. So you mentioned insulin resistance. And so what role does insulin resistance play in PCOS and fertility, and how can weight loss really help address it? So what is the role? That you kind of like mentioned it, but I want to go deeper.
Okay, so insulin resistance, basically what that means is everybody makes insulin to regulate your blood sugar, right? But when you have insulin resistance, that means your body doesn't recognize the insulin that you're making. So you might have high levels of insulin in your body, but the sugar needs to go into the cell from your bloodstream into the cell so that cells can work properly. But when you have insulin resistance, insulin is like the key, and it's just not working. So what happens is you get these high blood sugars all the time, and that starts to damage a lot of your organs. But to your brain, because the cells are not getting the sugar, your brain is like, I'm starving. And having those high levels of insulin means you want to eat more, right? Because your body's like, well, I'm not getting the sugar. Like, what are you talking about? So then you just want to eat more and more, because your body's like almost like in starvation mode. And so you see how, like, by having insulin resistance, your body's telling your brain like you're not eating enough. But the reality is like you're kind of like broken in the sense that you're not getting the sugar to where it's supposed to be. So by like giving somebody a medication that will treat their insulin resistance, but meaning, okay, now we're going to make you more sensitive to it, then guess what? Now you start to see results. Right?
And I guess they also start seeing like, I realized that I wasn't as hungry I should have, right? I'm not eating as much.
Right, because now their insulin levels are lower, right? Because you don't need as much insulin to get a response. Yeah. So now you're not eating as much. Now you're feeling better. And then another thing that I like to tell people is like obesity is an inflammatory disease. There's so much inflammation. So once you treat the obesity and you start to lose weight, all those like fat cells make hormones that are inflammatory. So once you start to lose weight, the inflammation also goes down. And so then that makes it so that it's easier for you to get pregnant. It's easier for you to ovulate. Like one of the first things that my patients see once they start losing even like 5 or 10 pounds is like, oh, I got my period. And they they weren't getting their periods, and all of a sudden they're getting their periods. And now they can actually, when you get a period, that means you ovulated. And so now you can actually get pregnant.
So that's one of the things that I hear the most. Like I started this weight loss routine, and I just spoke with someone a few days ago, and she was like, I didn't get my period for 8 months. And now that I'm doing this, then I'm getting my period back and I feel better. And now I have energy because all the energy is being used. But another thing that they see is like, I have chronic inflammation. And I'm so glad that you touch into it causes inflammation because they're like, I have inflammation and I don't know how to get rid of it. So chronic inflammation or inflammation, like you're saying, it will make it harder for them and it'll make the reproductive system work harder or not work at all. So are there any specific lifestyle changes that you're going to recommend alongside with the treatment for women that are specifically PCOS? You selected the medication is going to give them the kickstart, it's going to hold the key. What are the next steps that you see they have to take or they normally take?
So once you have the medicine help you with those cravings, then you can make better choices. So I always tell patients like, you don't want to eat incredibly processed food. Okay. So what I mean by that is like, if it comes in a package and it has like 20 ingredients, that's too processed. Keep it simple, right? So make sure you get like chicken breast, for instance. That's a lot of protein, but it doesn't have a lot of additives. Pair it up with some vegetables. You can have rice. I don't think carbs are bad. You can, unless you have diabetes and you really have to cut back. But if you don't have diabetes, carbs are not necessarily a bad thing, but some carbs are better than others, right? Like, do you just want to eat a cookie that's pure sugar? No, because that's going to cause inflammation. That's going to cause an insulin spike. And so that's going to cause you to feel like hungry, right? And so it's not good for you to eat super processed food. So that's number one. The number two is you need to focus on the protein because protein itself will naturally bring up the level of hormones to make you feel full. And so if you feel full for longer, then you don't have to overeat. And so it helps you stick to a diet that's like healthy. But even just removing like all those harmful things, I think there's a book called It Starts with the Egg. I don't know if you're familiar with that book.
Oh yeah, I love it. I recommend it to everybody. I have a whole episode on it.
It's a great book. And I've actually read it. And I can tell you like, it tells you like, you need to improve your egg quality by eating good food. So like there's a lot of things you can change in your lifestyle. Food is one of the most important things, but also like the products around our life are also, there's a lot of plastics and hormone disruptors and things like that. So that does matter. So, when you're looking at how I can change, starting with food is the first thing. I would say just trying to eliminate those harmful, like very, very processed foods. And then after that, and I have a very much of an approach of like, I don't like to overwhelm patients because I feel like you're setting people up for failure if you want to change everything. But if you can just say, hey, we're going to work on our food these next few weeks. And then in a few weeks, once they got that down, you're like, hey, we're going to work on your diet and your exercise. Then it like makes a big difference.
And I feel like I have the same approach because they have watched so much, researched so much, done so much. And I'm like, you already done so much that you don't need to do it all at once because you're stressing. So another thing that we see with stress eating. So can you speak about like how stress impacts your choices too, right? Your emotional state, sometimes it has an effect.
Yes, no, emotional eating is a real thing. So a lot of times it's about pausing before we eat something and really ask ourselves, am I eating because I'm bored, because I'm sad, because I'm stressed, or am I eating because I'm actually hungry? And then also surrounding yourself by healthy snacks, right? Because if you're going to have snacks in the house that are like chips, dips, chocolates, then that's what you're going to eat. And pretty soon you just ate more calories than you should have, right? So I always tell patients, like, ask yourself when you're about to snack, why am I snacking? Is it because you're hungry? If you're hungry, you should eat. You should listen to your body. But a lot of times if the answer is like, oh, I'm not really hungry, then maybe we should pass on the snacks, And if you're going to have snacks ready for you that are healthy and that are like, for instance, I'll cut up vegetables and I have like carrots or, celery sticks, or a lot of my kids love strawberries. So we have strawberries in the house all the time. So you just have to prepare for those moments of, it's going to happen, but you need to always pause and kind of think about, well, do I need to eat this?
Yeah, well, thank you. I think the one thing that you touched on earlier was how even a small amount of weight lost or like 5% will impact ovulation, hormones. What are the greater impact? Because I know like women are trying to get pregnant, but after the positive pregnancy test, there will be pregnancy and there will be delivering the baby and there will be chasing the baby, right? Okay, so we're thinking of a whole, like it's a whole, well, it's not just for the positive pregnancy test. So I want you to speak more like this is not just something that you do because you want to go to a wedding or you want to get a positive pregnancy test, how they can see this impact at a greater like.
Okay, so that's a great question. So basically, I recently had a patient last week, found out she was pregnant. Okay. So I will say, and we actually were not planning on her getting pregnant because we wanted her to lose 30 pounds before she started trying. Because here's the one thing, and this is what made me think of it. A lot of these medications you cannot take while you're pregnant. In fact, as soon as you find out that you're pregnant, you need to stop them. And some of them you should even stop a month or two before trying. So I do discuss that with my patients like, hey, we're going to have to focus on weight loss first, and we're going to have to put the medicine, like the trying aside until you reach your goal. But I'm sure you've heard about this Ozempic baby thing on the news. Okay. So one of the medications I prescribe is Ozempic or Wegovy for weight loss. Ozempic is more for diabetes. And it's true, like patients will get on it, they start losing weight, and I had a patient who had been trying to have a baby for 5 years. And so she was like, there's no way I'm going to get pregnant. But guess what? She lost, I think, about 10% of her body, and all of a sudden she had a positive pregnancy test. And so we had to basically say, okay, as soon as she found out, I said, okay, we're going to have to stop your medication because we need to be safe. And then, we need to make sure that you come back to me once you have the baby and you're done breastfeeding, because we don't prescribe these medications with breastfeeding either. And then she's going to come back after she has the baby and we're going to work on her weight loss again. I mean, it's just sometimes you have to just take a pause because when you're pregnant, it's about, making sure you're growing a healthy baby.
So what you're saying is like, if this is a goal and obviously like going into pregnancy with a healthier weight, with a healthier, that's what I tell women, like, yes, you want to get a baby, but what if we get you healthy first? And I think that's where you're coming from. Like once this medication is not going to be available to you, but they are going to be going into pregnancy, and the risk of then getting them gestational diabetes is going to be higher too. So I know you don't see them during pregnancy, but what would you say will be the risk that they will be taking if they just go right into it? Or not necessarily a risk, but they're more prone to gestational diabetes. I had gestational diabetes with my last one. I'm not somebody that struggles with weight, but I know for me during the gestational diabetes, having 1 tablespoon of rice spiked my insulin like huge.
Right. So one thing I will say is, yes, that if you have obesity going into your pregnancy, it will increase some risk factors in terms of, like you said, gestational diabetes, maybe having high blood pressure during pregnancy, preeclampsia. It does increase some of those risks, but you also don't know, right? Because then we also have women with obesity who have completely healthy pregnancies. But I do think that in general, we want to make sure that we're as healthy as we can be going into pregnancy. So you're right. Like if you can just take some months off to really focus on your health pre-pregnancy, that's probably more ideal. Because like for you, when you had your gestational diabetes, a lot of that is driven by the placenta. But if you already have some hormonal issues beforehand, then you're just going to make it worse. So I definitely think that taking care of your body before pregnancy is very important. I want to mention one more thing that I just thought of. Also, if you are on a GLP medication like Zepbound, Wegovy, or Ozempic, if you take oral birth control, it will not work the same way because your stomach does not absorb the medication the same way because it kind of slows down your digestive tract. And so you don't get the same levels of birth control in your body. So I always tell women, like, if you think your birth control is going to work on these medications, it's not. And that's another reason we get a lot of Ozempic babies. Because people are like, well, I was on the pill, but it's like, no, you have to find other ways to not get pregnant.
It's good that you mentioned it because that Ozempic baby thing is like, oh, Ozempic, make me get pregnant. So I was thinking the other day because I did meet somebody that was taking that medication, and she was like, I want to lose this many pounds, so I don't know if I ever have a family. And I'm like, well, Ozempic babies are a real thing now, right?
Yeah, no, it's true because you're become metabolically healthier with those medications. So your metabolism is healthier, your hormones are better, your inflammation is down. And so then your body's like, oh, I'm ready to have a baby.
Yeah. Can you speak more about the metabolic healthy stage? What does that mean?
So when you don't have insulin, it's back to the insulin resistance part of it. So when your hormones are more stable and you're not having these insulin spikes, kind of like you were talking about when you were pregnant, you were tracking, right? So you would see how, oh, you had a little rice. Now my sugar is like 170. or something crazy, right? So that doesn't happen. Like your sugars are more stable. And so your body is not dealing with all the inflammation associated with that, all the metabolic dysregulation. And so you are able to hopefully get pregnant. So all of the lifestyle is very important in trying to get pregnant. But I also will say it is also important to work with your fertility doctor if that's the goal, because there are sometimes structural issues or other issues that are not necessarily health related, like metabolically related. So it's always good to get a full workup to know what you need to work on.
Not as a woman, there's a lot of things that we don't see or that we don't even feel, like a blood tube or something. So they do need to investigate if there is something they've been trying for a while.
Mm-hmm.
And they sometimes need surgery. And that's not something that you can see, that it needs to be investigated. So you did mention earlier, there are some misconceptions about the relationship between obesity, weight loss, and fertility. Where do you see the biggest misconception that you're like, I can talk about this, I can just like shake people on this one?
So I really look at obesity a lot like alcoholism now. And so I'm going to use that analogy because, you know, a lot of times people with an addiction like alcoholism will just say, well, you should just try harder, right? But really, like alcoholism is a disease like other addictions, right? People are wired differently. Their brain is not wired the same way as somebody who doesn't have alcoholism, right? So obesity is very similar to that. It's like, it's really something up here in your mind where you don't sense like fullness the same way as somebody who doesn't have to deal with obesity. And I think that's one of the things I've realized now that I treated people with obesity. And like I have patients in my clinic that have lost 100 pounds. And I can tell you, like, when I started them on treatment, they were like, wow, for the first time in my life, I feel full. So they, instead of eating 2 plates of food, they were eating like a normal portion. And it wasn't a struggle for them because they actually, that signaling between your brain and your gut was actually working properly because of medication. And so they are actually able to lose weight. And then once you start to feel better about yourself, you're a little bit lighter. Guess what? Now you're working out more, you're eating better. So I think the biggest misconception is that it's very simple, like calories in, calories out, like diet and exercise. It's really not. It's a little bit more complicated than that. And I think we should be a little more kinder to people who struggle with obesity. It's kind of like how we need to be kinder with people who struggle with other things like addictions or alcoholism. It's very similar to that.
And for women that are struggling with fertility who don't have PCOS, so they don't have any of those, anything diagnosed, right? And how would they still benefit? I mean, the overall health benefits, right? All systems benefit by us having a healthier life, but specifically in infertility or fertility challenges, would they still be recommended to be in a healthier weight? What would still be the general recommendation?
So I want to speak on this a lot. And weight in fertility is super important because another thing that people don't talk about is if you are not at a certain weight, even if you're completely healthy otherwise, you don't have blood pressure, you don't have diabetes, you're fine, but you are like a BMI above 40, you're not going to be a candidate for certain treatments. So like their clinics, fertility clinics have cutoffs for when they can treat you. So let's say your BMI is 40, your clinic might be like, we don't do IVF for patients above 35. So even if you're completely healthy, you don't have PCOS, they're never going to be able to treat you aggressively just based on your weight. So a lot of times you do end up have to lose weight just to be even meet criteria for treatment. So that's one of the reasons I always tell patients, like if you're thinking of getting fertility treatments, you're going to have to lose weight or you're not going to get the treatment. And the reason is because a lot of when you go under IVF, for instance, you have to go under anesthesia, and anesthesia has cutoffs for weight, just on your weight. And so they won't do it because they're like, well, we can't treat, you're considered high risk just based on your weight. So a lot of women don't know that. And they're like, I can just go to the fertility doctor, they'll fix it. But then if they're too heavy, they might say no, you know?
Thank you for speaking on that. Because sometimes they just hear like, we can't treat you. And they're like, why? Like they feel it. They feel that as a judgment rather than it's not safe for you. And again, because the emotions are high and they have a very specific desire for a family. So some doctors don't really sit down and explain all those things. I'm so glad that you're here saying it won't be safe for you. This is why they're saying they can't treat you. You need to lose weight. So will you say like, doctor to doctor, obviously they have a lot of patients. But what will be something that you want people to understand from the doctor perspective?
Yeah. So if you ever go to the doctor and you're struggling with fertility and the reason that they're not going to treat you is weight, then you need to ask that doctor, okay, I'm interested in weight loss. Can you refer me to somebody who's going to help me lose weight? Because I think in the old days, right, 4 or 5 years ago, and even now it still happens all the time, people will go to the doctor and the doctor just be like, oh, just go see a nutritionist. Yes, going to see a nutritionist or a coach or somebody that can actually guide you through the process is very important. But some people do need medication. Some people even need surgery to lose weight. You see, like gastric bypass. So I think that you shouldn't settle for an answer of like, oh, just go lose weight. It should be like, okay, well, who do I need to see? Who needs to be my team? Like, do I need to find a nutritionist? Do I need to find a coach? Do I need to find, you need to have a team sometimes to help you get to reach your goals. Because I think that's what breaks my heart the most is because I get a lot of patients that come to see me and they're like, well, everybody just kept dismissing me and telling me that I just needed to lose weight, but they weren't giving me the tools.
And that is very common to see. And across the board, sadly. And that's, I tell my clients, it's like doctors are busy. And sometimes if we're not asking the right questions, then we're not getting to the right place. Right. So we need to get better about asking questions. If you get, like, I was told something about my health and I'm like, okay, I'm the person that is going to ask you, like, and then where do I go? What do I do? And what kind of resources are available to me to manage this specific issue? But more into the weight loss, I get non-fertility related. A lot of women are like, it sounds good, but I'm good. I'm not trying to have a baby. I'm not trying to go to a wedding. I'm not trying to do anything. So I'll be fine if I lose 20 pounds next year. So what would you say to, or the New Year's resolution, I want to lose weight. I get a lot of women just in general that they think weight loss is for looks, it's not for health. And we're not taking that as seriously going into perimenopause, menopause. How is that going to affect beyond menopause? Talking about hormones.
So one thing so I know what you're talking about. It is, I do like that we live in this area of body positivity, but I also think body positivity has gone too far where we basically have told people like, oh, it doesn't matter. If you're bigger, it's totally fine. Well, that's not exactly true long term. Okay. Because maybe you're fine now. Maybe right now you don't have high blood pressure. Maybe you don't have diabetes. Maybe you don't have sleep apnea. Maybe you don't have this list of problems. Maybe you don't have cardiac disease. But if you continue on this track where every year you keep gaining weight and now you're 50, 100 pounds overweight, guess what? You are going to start to have those problems. You're going to start to have knee issues. You're going to have metabolic issues. You're just going to start having a lot of problems. So I always think we need to think about this as a preventative thing, even if you're for the most part healthy, trying to get you to a good weight so that you prevent a lot of the diseases that come your way. Because I also work in the hospital and I can tell you so many times I meet patients, I'm like, man, if we had, now they're in their 50s, right? If we had really gotten a hold of your metabolic health when you were in your 30s, maybe you wouldn't be so sick right now. You see what I'm saying? So over time, it does start to cause more issues.
Have you seen any specific issues related to women that are not like human, but they're like women have this specific, most likely encounter these issues if they don't get a hold of their weight or their metabolic?
So one thing specific to women is obesity is also related to higher rates of cancer. So like things like breast cancer, right? Because like your fat cells also release a lot of hormones. So like you might have higher rates of breast cancer, uterine cancer. And so it is very important as a woman to keep your weight a little bit on the lower side. You want to be kind of in the normal range. Like I'm not here to advocate being like super skinny. That's not what this is about. It's about being healthier, especially if you do have true obesity. So
are there any last thoughts? You're like, I want to leave you with these 2 things that I wish somebody tells all my patients 10 years ago that I can shake people on it and be like, this is what you need to learn from me.
Okay, number one, I want to say, like, if you are struggling with your weight and somebody tells you, health provider tells you like, oh, just lose weight, but doesn't give you the tools, you probably need to find a second opinion, somebody that is going to help you, because in 2025, that is not the correct answer anymore. We have the tools, whether it's intensive coaching, whether it's some medication, maybe surgery, but we have ways to help you take control of your weight. So that's the most important thing I want your viewers to take is like advocate for yourself. Don't just settle for that response. Find somebody like you that can help get them healthier. And then 2, I guess just, for this one's hard because like I know a lot of people still feel a lot of shame when they talk about their weight. And so I do think we need to talk about it more. So it's so nice to have platforms like yours where we're having these discussions, because we need to normalize talking about how obesity is a disease so that people don't feel so much shame when they go and get treatment or help with somebody.
My last thing, because it's in the back of my head, is fad diets. People that get this miracle product off the internet, they're like, this is going to help you. Like my husband gets those. He's like, Ariana, I got this thing that is going to detox me. And they say that just by taking this pill or supplement, I see the before and after pictures, and this is what it's going to do for me. So what is your take on people just going over the internet, TikTok, all these things, and getting pumped into do these things without an actual proper evaluation, what is really going on and what's causing them? What would you say to anybody that is going through all of that?
Those products are not FDA approved. So that means that they're not regulated at all. So in a lot of times people are just selling you these quote unquote miracle supplements, but really it's just a money grab. Even as a business owner, I get companies all the time come up to me and be like, hey, will you recommend my product to your patients? And I always say no, because if there's no evidence behind it, you're not going to get much out of it, So I really think honestly, the true way that you can help yourself if you don't want to take medicine is really that processed food. You have to eliminate it. That's really so bad for our health. If you want to really none of this is going to be a quick fix, but just really working on your food and what you eat makes a huge difference. So I don't believe in fad diets, but I always tell my patients the less processed food you eat, the better. And then if you are going to have something that's, a little bit, be snobby with it. So make sure it's the best piece of cake you're ever going to have. Maybe you don't want to eat that piece of cake from Walmart, but if your mom makes a really good cake for Christmas every year, then fine. But just have to be more picky with what you eat.
All right. Well, thank you so much for being with us. Is there any resource, anything that you say? Obviously, your information is going to be in the episode. Anybody can contact you. But is there any last resource that you want to say, go check this? This is the one thing that I tell my patients, or the one thing that I will say to you if you're my loved one and I want you to get this information.
So a lot of patients will ask me, how do I find a doctor like me in their area? So I will leave your viewers with this. So if you're looking for an obesity medicine board certified doctor, you can go on abom.org. And then there's a link there where you can find physicians in your area that practice obesity medicine. That way, when you go see somebody, you're actually seeing a specialist that's going to treat you with kindness, that's going to be familiar with different options. And so I really recommend that people go to that website if they're trying to look for more help when it comes to losing weight.
Well, thank you so much for spending this morning with us. We deeply appreciate your insights and the awareness that you brought into the topic regarding the shame, the resources out there, and how they managing their weight can actually improve and optimize their fertility chances. And again, even you saying why doctors will not treat you or would do a certain things if you are above a certain way. I think those are great insights for our listeners and our viewers to take, because sometimes we just get an answer and we don't know what to do with it. So thank you so much for spending this time. If anybody wants to get in contact with Doctor, again, the information is going to be in the comments. And
thank you for having me.
Thanks for tuning in. If you enjoyed today's episode, we got a special treat for you. Join our free Facebook group where you can connect with other amazing women and share your thoughts. Join us by clicking in the link in the show notes. We can't wait to welcome you into our supportive community. And don't forget to come back for our next episode, where we'll be sharing even more inspiring stories, encouraging tips, educational insights, and practical strategies. Oh, and before you go, we have a tiny favor to ask. If you found today's episode uplifting and helpful, please leave us a review. It's like giving us a virtual hug, and it helps other amazing women like you find our show. Plus, it makes us smile from ear to ear. And hey, why stop there? Share the love. Tell your Betsies, your mom, your sister, and even your favorite barista about our podcast. The more, the merrier.